Transcultural Nursing Care of Hispanics by Jeannie, Tracy, Lee, Desiree, and Anna. According to the United States Census Bureau, 17.6% of the population identifies as Hispanic or Latino as of July 1, 2015. That is a 1.3% increase of Hispanic and Latino Americans over the past 5 years. According to the 2014 United States Census Bureau, there are approximately 54 million Hispanics living in the United States. Also, the United States is ranked second based on the population size of Hispanics. Mexico was ranked first with approximately 120 million Hispanics. Latino and Hispanic are oftentimes used interchangeably to refer to a diverse population of individuals of Latin or Mexican American descent. Regardless of their origin, here in America, Latinos face significant obstacles that contribute to them living in rural, poverty-stricken communities without access to health insurance. Hispanics is a broad term encompassing those from Cuba, Mexico, Puerto Rico, and South or Central America. When referring to culture, this includes how a group such as Hispanics live their way of life. Health beliefs and values. Hispanics value familial units, which has the potential to influence mortality. Familismo is the concept that a resilient relationship with one's family has the potential to promote health, prevent disease, and encourage economic security. Mexican Americans view optimal health to expand and include the physical, emotional, and social, interactional, and spiritual integration of the family unit. Curanderismo is a folk medicine system that is practiced by most Mexican Americans and is considered culturally acceptable and affordable. Curandero treatments consist of rituals, prayers, blessings, physical modalities such as massage or healing touch, and medicinal treatments that utilize herbs, plants, and other supplements. The patriarchal structure grants the father, spouse, or oldest male greatest power and can determine when a family member is allowed to seek medical attention. Contracting a disease is of biggest concern among the Hispanic population compared to dying. This can be attributed to health disparities that this population faces on a daily basis, such as living in poverty, lack of insurance, illiteracy, mistrust in the system due to language barriers, and fear of seeking health care because of illegal immigration status. In traditional Mexican culture, it is believed that illness results from 3 causes: sin, imbalance, and witchcraft. Providing care to childbearing women. The childbearing age for Hispanic women is 27 years old compared to 36 years old for non-Hispanic women. Hispanic women experience the highest birth rate among all U.S. women. Additionally, 25% of pregnant women are diagnosed with HIV or AIDS, and 75% of those women are of Hispanic origin. The transmission rate for the population is a whopping 25%, but with adequate prenatal care and HIV and AIDS treatment during pregnancy, this rate drops to less than 2%. This means that prenatal care among Hispanic childbearing women is of utmost importance. But why are these rates so high? Disempowerment among Hispanic women deters preventative measures to be a topic of discussion, such as condom use and testing. This is especially true for Hispanic women who are heavily influenced by their male counterparts, which is called machismo. HIV and AIDS rates are higher among Hispanic women because they are 2 times more likely to be in poverty and 3 times more likely to be uninsured. This leads to lack of preventative care, prenatal care, and testing or treatment. Lastly, 42% of Hispanic mothers have less than a high school diploma, which limits their knowledge about sexuality and reproductive health. Culturally competent care required for this age group includes asking questions via an interpreter in a safe and non-judgmental way, providing community resources that are available to assist the Hispanic community, educating on the importance of prenatal care and testing, as well as providing printed materials in preferred language. Providing care to children from birth to 17 years old. Hispanic and Latin American children learn early in life the importance of a deep sense of family responsibility, rigid definitions of sex roles, respectful and reverent treatment of the elderly, and the male's position of respect and authority in the family, also known as machismo. Also, Hispanic children have been taught not to hold eye contact with persons in authoritative positions. Nursing considerations for this age group. Since parents are highly involved in the care of their children, work together with the parents and keep them informed to ensure high-quality care is provided. Do not speak English to the child if the parent speaks little English. Communicate in Spanish via professional or virtual interpreter. It is important to remember the parent feels involved and is able to understand what you are asking their child and teaching them. Among the Hispanic culture, it is believed that if someone touches a child's head, a disease called caída de la malaria would develop, causing dehydration and vomiting, resulting in a fallen fontanelle. Providing care to adults 18 to 64 years old. Approximately 43% of Mexican Americans older than 20 years old are obese, compared with 33% of the non-Latino white population. This is partly due to the fact that Hispanics believe being somewhat overweight or gordito can be considered healthy. With this being said, nurses need to take caution when performing a physical assessment on someone of Hispanic origin, because a naked body is avoided and will cause embarrassment even among family members. To maintain respect and dignity, Hispanic female adults prefer women healthcare providers. Hispanic women, especially Hispanic pregnant women, are affected by their economic and educational status, so much that it places them at a higher risk of domestic abuse and violence. Some nursing considerations for this age group. Mexican adults tend to be soft-spoken. If their voice is raised, it is usually indicative of anger. Don't address a person by his or her name unless given permission. Nodding can be misinterpreted as understanding in Mexican patients. This is not always the case. Nodding is usually shown as a sign of respect. Latinos expect that healthcare providers demonstrate simpatia and personalismo, which translates into formal friendliness. Latinos may read the neutral or business-like affect of Western doctors as negative. Providing care to adults over the age of 65. Hispanics in the United States, despite their lower socioeconomic status, income, and population health, tend to outlive non-Hispanic whites by almost 3 years. There are many challenges with the increased Hispanic population in the United States. Most of these challenges are due to health issues, language barriers, and different cultures and beliefs. Of the health issues, diabetes affects 1/3 of the population. There is a high risk for depression and end-stage renal disease for older Hispanic adults. Misdiagnosis is much more common in Hispanics. Approximately 50% with Alzheimer's have not yet been diagnosed. Some nursing considerations for this age group include increasing the number of Spanish-speaking nurses or having a knowledge of basic Spanish terminology will assist in communication. Nurses can also hold the practices, beliefs, and values as a priority. One way to do this is increasing knowledge on cultural competency and diversity. Learning to detect mental health issues in Hispanics by participating in trainings can avoid possible misdiagnosis. Lastly, use educational materials in Spanish when discussing treatment plans or plan of care options. Providing care to Hispanic communities. Some of the reasons why Hispanics and Latinos fail to seek medical care are financial difficulty, lack of health insurance options, lack of transportation, inability to take time from work, difficulty scheduling appointments, embarrassment, and procrastination. However, once they finally do seek medical attention, ensure quality patient and provider communication so that adherence to the treatment plan is successful. To sum up this presentation, it is important to remember that while Hispanics are a minority, they make up 17.6% of the population. When remembering health values and beliefs of this group, remember that they rely on traditional healing systems. They also value family that promotes health and helps prevent disease. They also believe that sin causes illness. In childbearing women, encourage prenatal and preventative care. Also empower women. When providing care to children from birth to 17 years old, remember to include their parents and understand that rigid sex roles are taught to these children at an early age. When providing care to adults 18 to 64 years old, make sure that you maintain dignity, demonstrate formal friendliness, and educate on obesity, as this is very common among Hispanics. When providing care to adults 65 years and older, make sure that you complete thorough assessments so that mental issues can be detected earlier, such as Alzheimer's. Also, increase your knowledge on diversity. When providing care to Hispanic communities in general, ensure patient-provider communication, as this ensures that the population is receiving the appropriate care. Also remember that they value social interactions and that church and family are the center of community. This concludes our presentation on how best to provide culturally competent care to Hispanics. We hope that you are able to take away something new and incorporate it into your nursing career.